Hi guys, thanks everyone for joining us today. So everyone that's in Healthy Hustlers, you guys I'm sure have all seen Dr. Kyle Wallner posting, heard his name. He jumps in and on a lot of posts, is very knowledgeable. He is a chiropractor in Michigan. Gotta love, not that I love Michigan, I have to say that I'm in Ohio. However, gotta love technology that we can sit and do these videos from different states. It's so awesome to be able to connect like that on social media. But he is a chiropractor at Michigan Family Wellness. And today we want to talk about ear infections, especially with it getting, we've got our first big snow day and the weather is getting kind of yucky outside. And so we're seeing a lot of kids getting sick. And I see a lot of moms posting about ear infections. And I will say in the past 3 months, my 15-month-old she had her first ear infection and then she had a second one a couple months later. And we went to the doctor, and the doctor immediately wanted to prescribe an antibiotic. And she's never been on an antibiotic. I'm not a big fan of antibiotics. And so I went home and I did my research and learned a few things, which has, prompted this call tonight. So one of the things I learned was that ear infections are the number one reason that antibiotics are overprescribed by pediatricians, which was crazy to me, but registered also with how quickly she prescribed that antibiotic. The second thing I learned was that majority of the ear infections will heal on their own naturally. They start prescribing antibiotics because it helps them heal a little quicker and it gets parents back to work quicker, which is not always what's best for your child. So I started looking into garlic oil in the ear. We already go to the chiropractor, so I called our chiropractor and said, should I get her adjusted again? What can help? And you can kind of give us some more info on that. But that's what brought me to this, is we have now cured 2 ear infections in our house in the past few months without antibiotics. And I see just all these moms talking about, their children having ear infection after ear infection and wanting to learn more about curing them naturally. So instead of just listening to me, because I'm just a mom who cured my own ear infections and my kids naturally, I wanted to consult an expert and talk to you because you are trained in things that I just have, that's out of my capabilities. So we want your expertise. And I guess if you could kind of tell us, a little bit about why we see so many ear infections and how, the ear works and just your best advice as a chiropractor and how to cure them naturally.
Absolutely. Well, hey, thanks so much again, Brandy, for the chance to come on, with the Healthy Hustlers here. Again, my name is Dr. Kyle Wallner, and we are right here in Southeast Michigan at the Michigan Family Wellness Clinic, where we do specialize in family wellness care. And oftentimes that looks like taking care of pregnant women, children, individuals, and then actually working with the entire family as well. So to respond to Brandy here, you're absolutely right. Ear infections are so common. They're one of the most common things that happens with pediatrics and kids. And because they're so common, then that leads to, like you were saying, the prescription of a lot of antibiotics. And another thing I wanted to mention too is, again, it's not that, there's a component of being kind of the anti-pharmaceuticals, but especially with antibiotics, that's also messing with the gut microbiome as well, which I know you guys think about a lot and talk about a lot, and again, going off into several different tangents, we can go with that too. But when you look at C-section rates, when you look at how children are entering the world today, the microbiome is a major, major deal. So when they're being prescribed an antibiotic for their ear infection, it's like, yeah, you want to help them get out of pain, but also think about how that's affecting their gut health too. So I wanted to insert that little context for you as well. But yes, clinically speaking, otitis media, otitis externa, otitis interna, there's the inner ear, there's the tympanic membrane, there's the outer ear. And again, I am not a ear, nose, and throat specialist. I'm not a, ENT, someone that has gone to all that kind of schooling and that sort of thing. But as a chiropractic physician, we look at several different things as it relates to the central nervous system and as it relates to the immune system, honestly. So one of the things I wanted to mention is, again, if you guys have ever had a sty or an eye infection, right? What's the number one thing that you do oftentimes for a sty or conjunctivitis, something like that? It's heat, okay? Temperature will kill most bacteria, right? So this is one thing I wanted to equip you guys, especially the parents in the group here, is when your kid has any kind of an earache, ear infection, anything like that, start with heat. It's a great thing you can do, at midnight or whatever when they're having an issue, A great thing that I recommend to our patients here is actually, this is a device. It's called the Ear Ease, because it can be difficult to get like that warm compress that they talk about, like on your eye. Okay, heat up some water, put a warm compress on your eye. Okay, not that hard. But how do you get heat on an ear, especially on a kid, right? That can be difficult. So this is a tool. It's like a fancy cup. I don't know if you can see this.
Yeah.
You put hot water in here, and then you can apply that over the ear. And what does this do, right? This applies that heat to that part of the ear, the external auditory meatus, for an extended period of time, like a good 10 minutes, okay?
Okay.
So that's like one example, one practical application of how parents can really help their kids without the use of antibiotics, to really help out with their ear infections. Let me mention another one. Of course, I would be remiss if I did not at least mention. So obviously this is the adult spine, this is adult example, but these cervical spinal facet joints back here are what we look at clinically as they go to, if you can imagine, if I can demonstrate, there's innervation that goes to the ear from the spine, okay? Specifically C4, C5, C6, and even upper cervical as well, all right? And what this has to do with is the eustachian tubes, all right? Let's see if I can explain that more. So let's see. Here is our photo of our inner ear. Let's see if that'll focus.
Yep.
Maybe not. But anyways, you have, there it goes. You have the outer ear, okay? And you have, let's see how good my pointing skills are. This canal, all right? That's the eustachian tube, all right? It connects your ear to your throat. And when you're a kid, when you're an infant, even if you're up to like your mid-teens, all right, you're maybe even your early 20s. Again, everyone's different. Bodies don't read the anatomical textbooks all the time. Those canals can be horizontally oriented. All right, are we tracking so far? Does that make sense?
Yeah, absolutely.
So what does that mean? So if the canals are horizontally oriented, then that means that drainage of our sinuses, drainage of the pressure, buildup of mucus and phlegm and all of these cells can occur, whereas they're supposed to, as we develop, as we mature, skeletally and all that sort of thing, they eventually go more in a vertical orientation. Okay, so that's why this is so common for kids, because they're just not draining, gravity's not helping them because they're still in a horizontal orientation. So again, back to chiropractic adjustments, a great way to facilitate not only the immune system, to boost the white blood cell count, to release GABA from the dorsal root ganglion into the spine, help things calm down, but then to also facilitate the drainage and the flow of that mucus, of the phlegm, and help those eustachian tubes drain into the neck and then out through the body.
That's actually one thing that our chiropractor talked about when I took Anya in, and he taught me some, it was a while ago, I'd have to ask him, but he taught me some massage techniques to do with her. Yes. To help them, like for me to manually help them.
Yep.
At home after she was adjusted as well.
Yes, yes. Lymphatic drainage. I can equip you with that kind of photograph that I have of that, but essentially, going above the eyebrows, down the sides of the face, the nose, the lips, everything, and then even in through the neck. Very good to help with lymphatic drainage, a great manual technique as well. So absolutely.
Awesome. So I have a couple questions. One would be, one of the popular products, I know you and I have talked about this in the past, one of the popular products holistically that I see moms using, and it's what we used as well with chiropractic care, is the garlic mullein oil. What are your thoughts on that, and any advice for using it? Yeah,
I would say everything is case dependent as well. Obviously, if the child or the patient is a little bit older, I would definitely have more comfort recommending that.
Okay.
Perhaps like, 9, 10, 11 years old, totally fine. In the younger stages, when things are growing and developing, that's where I would use more caution. Perhaps using some kind of carrier with the, what you're talking about, so that it's not so intense.
Okay.
But anything like garlic, oregano, these things that are very strong and can be very aggressive in terms of their antibacterial, antimicrobial, antiviral properties, you just want to be careful because kids, like their tissues are so young and they're just so tender and sensitive, So if anything, I would just kind of start slow.
Okay.
And the principle that I would use with an adult too is like titrate the dose. So if you start at a level and it's like too much for them, drop it lower.
Okay.
Or start lower, with very small amounts. And then if they can tolerate that, probably try and go a little bit higher. But I will say this, kind of to your point of things you can place like in the ear itself. I do tell people, and this is very safe for kids too, hydrogen peroxide, right? This
Okay.
so cheap. The stuff's been around forever. H2O2, tilt your head to the side, couple of drops of hydrogen peroxide into the ear, and you don't have to leave it in there for very long. Again, remember, the tympanic membrane is a very sensitive tissue, and it can actually break and tear, and you can actually be bleeding out your ear.
Oh, wow.
We don't want to do that. So that's why I say be very gentle. But I love telling patients and kids, use a little bit of hydrogen peroxide, 30 to 60 seconds inside the ear, get a towel, let it drain out. You might feel some tingling, but that's a great way to stimulate the immune system, stimulate the vagus nerve, because there is a branch of cranial nerve 10, the vagus nerve, that does innervate the ear. And so we know that vagus nerve is very parasympathetic for gut digestion as well. But that's a very simple, very easy thing that kids and parents can do, for combating ear infections as well.
So with any of that, I want to just make a disclaimer to people. The stuff we've used, we've used the garlic oil, but I treat everything naturally first, but my caveat to that is I do it under the guidance of her pediatrician, even though I don't agree with, the treatment course that she recommends. I do try my way first, but I do it under her guidance and the chiropractor as well. So I just want to make that clear to moms out there too.
Yeah.
One thing I did learn was, and I think you might have been the one to tell me this, but that if the ear is leaking any kind of fluid, not to, anything, any kind of drops in the ear. So that's why you want to make sure if you're doing these at-home treatments to, go to your chiropractor, go to your pediatrician, and just kind of have them monitor. I'm not a doctor, so I can try all these things at home, but I have someone monitor what I'm doing just to make sure I'm not missing anything. So I just want to make that clear to the moms out there too, that love home, natural homeopathic treatments, but I tend to err on the side of caution and always have someone else kind of over my shoulder with those.
Yep.
One thing I want to ask is the ear ease thing that you showed us.
Yes.
Is that something that we can purchase on your website? Where do we get that?
Yeah, honestly, I mean, you can purchase it from the clinic here. Obviously, I'll just say this, it will be more expensive. You can find it on Amazon Prime.
Oh, okay.
This is not like a money maker for the practice. This is just, I stock them because oftentimes it's like a mom will come in with her kid and be like, help. And I'll be like, here, I have it.
Right.
So there's that. But for the people that want to be kind of proactive and preemptive in that way, honestly, with Amazon shipping, I can't compete with Amazon, right? So,
well, no, Amazon Prime, you order it today and you have it by Saturday. So.
Exactly. So I would do it that way. I can send you a link to it. But basically, I know the people that invented this, so that's why I think it's just brilliant. So yeah. Yeah,
you actually sent that to me before, and we have not purchased that yet. Knock on wood, we've had no more ear infections, but that's definitely something to try. I want to say something too, as we're talking about putting things in the ear. I've seen, and I think you and we were talking about heat, and I've seen moms ask about if they do an oil or anything in the ear, if they should heat it. And you had said at one point, yes, it would be okay to heat it. But I want to tell moms that if you're going to heat that, I want to make this kind of dummy proof. If you want to heat anything like that ever that you use on your child, heat it in a bowl of hot water, not heat it in the microwave. But you wouldn't heat the peroxide, right? You would use peroxide.
Correct. Yeah. Okay. Yep. Peroxide, just room temp. Okay.
No, I think that's great. Those are some big questions. Ear infections are a big deal, and there are just so many of them, and it's hard to see your child in pain. And again, the antibiotics, we use them when needed, but I don't like to use them because then you got to do a probiotic, and then you've got to heal
exactly
the antibiotic damage. So, anything else you want to throw in there?
Well, you mentioned the probiotic. I just want to reiterate that point. Having a really good probiotic, especially if there's been, like a C-section delivery, especially if maybe you're not able to breastfeed or you don't have access to breast milk. Probiotics, prebiotics, really good fibers, very, very important for the child's immune system, their gut health, which will translate to keeping their ears healthy, because this goes into bioimmunology and all that sort of thing, which is just really, really important stuff. Yes, the chiropractic, yes, the structural care. Not everyone has access to that, or not everyone, has a chiropractor that they trust, which I understand, but most people can get equipped with, really good strains of quality probiotics, some good fibers, and then if you have the ability to do breastfeeding or nursing or anything like that, honestly, that's the best thing you can do for the child's immune system.
So, real quick, I just read an article, and I'll put it in the blog when I wrap this all up.
Mm-hmm.
My aunt tagged me. It's on my Facebook page. But it's an article about probiotics and breastfeeding. Mm-hmm. And it was showing how breastfeeding actually like intensifies, or it like makes the probiotic work better in breastfed babies. And it actually was talking about how if a breastfed baby is on a probiotic, if they stop that probiotic, it continues because of the breast milk. It continues to work in their body for X amount of time after. Now, if a formula-fed baby is given a probiotic, when they stop the probiotic, it stops working in their system. It was a really awesome article. It's just, our bodies are amazing.
We can talk hours more about this essentially, but if I could just give you a little bit of shop talk, and feel free to edit out what you'd like. But if just specifically to that, what they've identified are called human milk oligosaccharides, okay? They call them HMOs. So there's these two sugars that are specific to human milk, okay, so breast milk.
Right.
These two specific sugars, like I said, they're only found in human milk, and they encourage not only the growth of the, the growth of the good bacteria, but to your point, the diversification of the gut microbiome. Because here's the thing, if every kid or if every adult is taking the same 3 or 4 or 5 strains from their probiotic, I mean, okay, great, like that's better than nothing. But here's the thing, what we're finding is much of the value from our gut health is from the diversification of our gut microbiome. So that's why I encourage patients to rotate their probiotic, every few months, so if you're taking one thing for a while, during the next season of the year, switch it to something else, because what you want is the diversity of the strains.
That's good to know.
Does that make sense?
Yeah, it does. I read that. The article I read about the sugars. The article talked about the sugars in the breast milk, and so that I do remember that you saying that, but I didn't even realize that. I do rotate my probiotic. Good. Yep. And I didn't do it on purpose, though. I would try a different one until I recently found pure encapsulation. I've been taking that, and I've been really happy with that, but I've been unknowingly rotating and doing something that I should be doing, so I'll have to make sure I keep doing that. Awesome. No, that was great. Thank you. And thank you for all of your info. Again, we'll post this for everyone watching. We will post this. I'll get a blog out hopefully in the next few days. I'd like to have it up by this weekend. If you want to send me some images, like you referenced an image in this video, I'll get that up there, and I'll put all of Dr. Kyle's info in the blog and links to his website. And just if anyone's in Michigan and is looking for a chiropractor, or just wants to connect with him on Facebook, he's great and very knowledgeable, and we love having you in the group. Thank you so much.
And thank you, Brandy. Thanks again for the opportunity.
Yeah, absolutely.
Talk to you soon.
All right. Take care.